Thank you very much, Assembly Members. We now move on to the next motion in the name of Assembly Member Best. And if I'd like to ask Assembly Member Best to propose it.
Thank you, Chair. And can I first start by thanking the Wave Trust, who are campaigning for a 70% reduction in child abuse, neglect and other adverse childhood experiences before 2030. And secondly, to thank Caroline Russell for supporting this motion with me today. I'd just like to first say the recommendations of this motion broadly reflect those in the Healthy First Steps report in 2018, agreed by a cross-party London Assembly Health Committee. And it bears mentioning that some of those recommendations are yet to be implemented, so it seems pertinent to bring this to the fore once more. And there's no better way to do that than asking the Mayor to explore a pilot of a pioneer community approach, a London-based ACES hub, and to meet with the Wave Trust and hopefully join the Prime Minister, the Mayor of Greater Manchester, and the majority of members here in this chamber in becoming a public endorser of the 70-30 campaign. Just to speak briefly to what a pilot pioneer community approach means. This is an approach to the first 1,001 days, which has been supported by the Royal College of Midwives, Institute of Health Visiting, Public Health England and the Local Government Association. It begins with a universal risk assessment in pregnancy and uses a community model as well as targeted support through the early years of childhood. Ideally, this would be piloted in a full London authority, but it could also be implemented in a single ward. And briefly on an ACES hub, there are many ACES hubs now around the country, the most developed probably being the ACE hub in Wales. They build understanding of the pervasive role of ACES and effective ways to mitigate their effect. Many English cities and countries have prioritised this, and we now risk falling behind the curve on this issue, despite the 2018 recommendations of this Health Committee. Like any underlying health issue, when we fail to inoculate children against the effects of trauma, we set them up for future ill health. We must inoculate against all trauma as we do physical illness. Through my work in children's services before entering the Assembly, I'm always struck by how many young people and families are let down through missed opportunities to tackle the root cause of their presenting problem, invariably leading to expensive and reactive solutions focused on symptoms, not cause. Our collective approach in public services is too often akin to giving a plaster to someone with a gaping wound and then wondering why they keep needing more plasters. So with the Wave Trust suggesting that 3 to 5% of local authority spending is spent on intervention in comparison to 40% spent on issues that could have been preventable, this could have enormous cost savings in prevention and boost the economic productivity. The right measures would pay for themselves many times over in the long run and save taxpayers huge sums. So, Chair, I propose this motion with huge gusto and hope that the Assembly can agree to it too.
Assembly Member Russell to second.
Formally, Chair, and enjoying the gusto.
Just to sum up, it seems obvious we aren't effectively intervening and inoculating at present. You speak to teachers, doctors, support workers, housing officers and key workers across the public and charitable sectors, and they could often tell you in primary school the children they expect to see in gangs, with issues with violence, addiction struggles and with health issues later in life. This is absolutely the right way forward, and I do hope that the Mayor listens to the calls if the Assembly is minded to accept this motion. Thank you.